Hello, welcome to Anatomy DAHAR series. Today's topic is about the larynx, cavity and muscles of the larynx. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Cavity of the larynx. Look at the diagram. This is the posterior view of the larynx. This is epiglottic. This is inlet of the larynx. This is thyroid cartilage. This is cricoid cartilage. This is inferior border of the cricoid cartilage. Below it is the trachea. Cavity of the larynx extends from the upper edge of the epiglottic above to the laryngotracheal junction at the lower border of the cricoid cartilage below. Superiorly, laryngeal inlet communicates with the lumen of the laryngopharynx, and inferiorly, the lower end of the larynx is continuous with the trachea below the cricoid cartilage. Inlet of the larynx. The inlet is facing backwards and upwards. It is bounded superior and anteriorly by the upper edge of the epiglottis. On each side, that is laterally, ariepiglottic mucosal fold, that is mucosal fold arising from the arytenoid cartilage to the side of the epiglottic, and inferiorly and posteriorly is interarytenoid transverse mucosal fold. These are the boundaries of the inlet. Subdivisions of the laryngeal cavity. This is the cavity of the larynx. We are looking from behind, that is posterior view. So this is anterior wall of the larynx. These are lateral walls of the larynx. Cavity of the larynx is partially divided by two pairs of mucosal folds, which extend from the lateral wall of the larynx. The upper mucosal fold is vestibular folds, and the lower mucosal fold is vocal folds. These two pairs of folds divide the cavity of the larynx into three compartments. They are A, the uppermost one is called vestibular or supraglottic compartment, and B, the middle one is called ventricle or sinus glottic compartment between the two lines of vocal folds, and the third one, the lowest one, C, is infraglottic compartment below the vocal folds until the lower border of the cricoid cartilage. Cavity of the larynx is subdivided into three compartments by two pairs of mucosal folds, vestibular folds, and vocal folds. The first compartment, or the uppermost one, is the vestibule, also called supraglottic compartment. It extends from the laryngeal inlet down to the vestibular folds. The second compartment is B, that is ventricle or sinus, also called glottic compartment. This is the one. It is the gap between the vestibular fold and vocal fold of the larynx, which bulges outwards, that is laterally, forming a deep horizontal groove. So this whole thing is the second part, the ventricle. The third part, C, infraglottic compartment. It is below the vocal folds. From here, it extends down up to the lower border of the cricoid cartilage. So this is the third part, infraglottic compartment. Beyond this is the trachea. This is again, we are talking about the cavity of the larynx. This is the ventricle or sinus or glottic compartment, the middle compartment. If you see above, here is vestibular fold, here is vocal fold, this is thyroid lamina. The lateral part of the ventricle compartment bulges outwards, that is laterally, forming a deep horizontal groove. You can see here a deep horizontal groove. Opening from its anterior end is a small pouch that is called laryngeal saccule. The saccule extends upwards between the vestibular fold and thyroid lamina. The saccule extends upwards between the vestibular fold and thyroid lamina. You can see on the right side of the diagram. It is provided with mucous glands whose secretions lubricate the vocal cords. Hence, it is also called organ of the larynx. This little one we can call organ of the larynx. We have two diagrams in this slide. This is the diagram of the cavity of the larynx. This is the second compartment, the ventricle. Above the ventricle is a pair of vestibular folds, and below the ventricle is a pair of the vocal folds here. You can see here, this little gap between the two vestibular folds is, you can see the margins here. This two vestibular fold is at the higher level with the wider gap here, compared to the vocal fold, which is at the lower level below the ventricle, and this gap between these two, that is the glottis, it's much narrower than the gap here. You can see here. So if you look from above, this is the picture taken looking through the laryngoscope from above. This is anterior, this is the base of the tongue, this is epiglottic, and behind that one you can see here, these two are vestibular fold, wider here and above. If you see more, below this is your vocal folds here. This is the vocal fold, here is vocal cords. The gap between this is glottis is compared to this opening is narrower. So vestibular fold is above with wider gap, and vocal fold is below the ventricle with the narrower gap is here. You can see. Okay. In the resting stage, during quiet respiration, the glottis, this is the one, is triangular in shape and about 8 mm wide at the back. The sagittal length is about 23 mm in male and about 17 mm in female. Mucous membrane of the larynx. As the larynx is part of the respiratory tract, it is in general lined by respiratory epithelium, that is pseudo-stratified columnar ciliated epithelium with goblet cells. Pseudo-stratified columnar epithelium with so many cilia with so many goblet cells. However, the places which are exposed to the passing of food are covered by stratified squamous non-keratinized epithelium. Which are the places? They are upper border and the upper part of the posterior surface of the epiglottis, airy epiglottic folds, and vocal folds. In this area, the epithelium is stratified squamous non-keratinized epithelium. Muscles of the larynx. They are of two groups, A. Extrinsic and B. Intrinsic muscles. A. Extrinsic muscles of the larynx. All the extrinsic muscles are paired muscles. They include palatopharyngeus, salpingopharyngeus, stylopharyngeus, thyrohyoid, and sternothyroid. All of them elevate the larynx, except the sternothyroid, number 5 muscles, which depress the larynx. Accessory elevators are 6 digastric muscles and 7 mylohyoid muscle. They elevate the larynx through the hyoid bone. Group B, intrinsic muscles of the larynx. Muscles that open the inlet. 1. Thyroarytenite and 2. Thyroepiglotticus muscles. Muscles that close the inlet. 1. Oblique arytenoids and 2 airy epiglottic muscles. Muscles that abduct the vocal cords. 1. Posterior cricoarytenoid muscles. Muscles that adduct the vocal cords. 1. Lateral cricoarytenoid and 2 transverse arytenoides muscles. Muscles that tense the vocal cords, cricothyroid muscles, and muscles that relax the vocal cords are number 1, thyroarytenite and vocalist muscles. Muscles of the larynx. They are of two groups, extrinsic and intrinsic muscles. Now we are going to talk about the extrinsic muscles. Extrinsic muscles attach to the larynx to the surrounding structures and responsible mainly for vertical movements of the larynx as a whole, especially during deglutition, swallowing. All the extrinsic muscles are paired. They include number 1, palatopharyngeus, coming from the soft palate. Next is number 2, salpingopharyngeus, coming from the auditory tube. Salpinx in Greek means trumpet, auditory tube. And third, stylopharyngeus muscles, coming from the styloid process. And some more extrinsic muscles, please see next slides. Extrinsic muscles, continuation, are number 4, thyrohyoid, and number 5, sternothyroid. Thyrohyoid, look here, comes from thyroid cartilage to the hyoid bone, number 4, thyrohyoid. Number 5, sternothyroid, coming from the sternum to the thyroid, number 5, sternothyroid muscles. All of them elevate the larynx. Number 1 to number 4 elevate the larynx, except sternothyroid number 5, which depresses the larynx because pulling from below, pull down. In addition, we have accessory elevators are present. Number 6, digastric muscles, look here, anterior and posterior belly. And number 7, mylohyoid muscle, which is attached to the hyoid bone. They will assist by elevating the hyoid bone and elevate the larynx. Intrinsic muscles of the larynx. This is the posterior view of the larynx. This is the inlet, epiglottic. This is cricoid cartilage. Lamina is here. Above is a pair of arytenite cartilages will be sitting on the upper border of the lamina of the cricoid cartilage. Now see the muscle first. The intrinsic muscles of the larynx alter the size and shape of the inlet or affect the vocal ligaments, causing their movements or changing their tension. The muscles that act on the inlet are the airy epiglottic, this is the one, number one, airy epiglottic muscles, and oblique arytenoids, number two, oblique arytenoid muscles, assisted by transverse arytenoid, this is the one, and thyroepiglotticus muscle, which is not shown in this picture. Those that affect the vocal ligaments are the lateral and posterior, that is this one, posterior cricoarytenoid muscle, oblique, this is the one, arytenoid muscles, and transverse, you can see here, arytenoid muscle, number 3, and thyroarytenoids, vocalist, and cricothyroid muscles, which I'm not showing here. All of them are paired muscles, except transverse arytenoid, number 3, which is the only unpaired muscles. Muscles that open the inlet. Let's see the diagram. This is anterior. This is the sagittal section. We are looking the inner surface of the left wall of the larynx. This is epiglottic. This is thyroid cartilage. Here is anterior. Posterior surface is the angle of the thyroid. Here is arytenoid cartilage. We have anterolateral surface. And below is the cricoid cartilage is here. So if you see here, this is airy epiglottic folds coming from the arytenoid cartilage going to the epiglottic. Okay. Now we are going to talk about muscles that open the inlet. They are thyroarytenoid, number 1, coming from the thyroid to the thyroarytenoid muscles, and thyroepiglotticus muscles coming from the thyroid to the epiglottic muscles. The thyroarytenoid muscles, number 1, extends backwards and laterally from the angle of the thyroid cartilage to the anterolateral surface of the arytenoid cartilage. Many thyroarytenoid muscle fibers ascend to the airy epiglottic fold. Many fibers ascend to the airy epiglottic folds, and some even reach to the margins of the epiglottic. They constitute some upper fibers of thyroepiglotticus muscles, also reach up to here, that is number 2. All of them, number 1 and number 2, together pull the airy epiglottic folds laterally and open the inlet. Some of these fibers pass laterally to the saccule of the ventricular part of the cavity of the larynx, and it presses the saccule. Muscles that close the inlet. This is the inlet of the larynx. This is thyroid cartilage. This is lamina of cricoid cartilage. Above the upper border of the lamina of cricoid cartilage is a pair of arytenoid cartilages here. Okay, let's talk about the muscle that close the inlet of the larynx. It is a combined action of the extrinsic muscles, group A, and intrinsic muscles, group B of the larynx. During deglutition, that is swallowing, group A, the extrinsic muscle, that is thyrohyoid, and accessory muscles raise the larynx nearer to the epiglottis. At the same time, from group B, 2 intrinsic muscle, that is oblique arytenoides, this is the one, and airy epiglotticus, this is the one. Pull the epiglottic backwards from behind. They will pull the epiglottic backwards. You can see here. Stretch and narrow the inlet. Actions of both extrinsic and intrinsic muscle together, therefore, almost close the inlet of the larynx. Oblique arytenoids, number 1, and airy epiglottic, number 2 muscles consist of 2 layers that cross each other like the limbs of the letter X. Each passes from the back of the muscular process, that is a lateral process of the arytenoid cartilage, to the apex of the opposite arytenoid cartilage. Then they prolong into the airy epiglottic fold as airy epiglotticus muscles. Now vocal cords, abductor and adductor muscles of the vocal cords. First, muscles that abduct the vocal cords. Let's see these 2 diagrams first. This is the diagram looking from behind of the larynx. Here is the lamina of the cricoid cartilage. There's a midline ridge is there. On either sides of the midline, that is posterior surface of the lamina of the cricoid cartilage, we have a shallow fossa is there. Here is a pair of arytenoid cartilages. Laterally, they have lateral process or muscular process. Now, this is one muscle you can see here that is coming from this fossa, that is posterior cricoarytenoid muscles. If you see from above, this is thyroid cartilage, this is cricoid cartilage. Above the cricoid cartilage is arytenoid cartilages are here. This is lateral process of the arytenoid cartilage. This is the anterior process or vocal process of arytenoid cartilage. So here is posterior surface of the angle of the thyroid cartilage is here. So what happens is when you do abduction of the vocal cords, this posterior cricoarytenoid muscles will contract and pull the lateral horns, the muscular horns of the arytenoid cartilage backwards. You can see here backwards. So arytenoid cartilages will rotate outside, and this is the vocal cord is attached here. They become widened here. So glottis become widened by the posterior cricoarytenoid muscles. Therefore, posterior cricoarytenoid muscles, that is number 1, they are the most important muscles of the larynx. Even you can say the most important muscles in the body, as they are the only muscles that open the glottis, as they are also called safety muscles of the larynx. So that these are the posterior cricoarytenoid muscles are also known as safety muscles of the larynx. Muscles that adduct the vocal cords, that is closing the glottis. It is done by 2 muscles, lateral cricoarytenoid and transverse arytenoid muscles. Let's see these 2 diagrams. Diagram A here, thyroid cartilage. This is angle of the thyroid cartilage, cricoid cartilage, lamina of the cricoid cartilage. On its upper border is a pair of arytenoid cartilage. Here, this is the lateral or muscular process of arytenoid cartilage. This is anterior or vocal process of the arytenoid cartilage. This is vocal cords attached from here to here. That is the angle of the thyroid. Same thing if you see here, this is Arytenoid cartilages sitting on the upper border of the lamina of the cricoid cartilage. Now you look here very carefully. Very first muscles is lateral cricoarytenoid muscles. That is, look here. This muscle is coming from the upper border of the arch of the cricoid cartilage, goes backwards and attached to the front of the lateral process, that is the muscular process of the arytenoid cartilages. What happens is when these muscles contract, it will pull the lateral process of the arytenoid cartilages forward. That means this cartilages will rotate so that anterior vocal process will come nearer, that is adduct. Then vocal cord will be, two vocal cords will become nearer and adduct this glottis. Next muscle is transverse arytenoideus muscles. Look here. This is again arytenoid cartilages sitting on the upper border of the lamina of the cricoid cartilage. This is lateral process. This is anterior or vocal process. Here is another muscle called transverse arytenoid muscle. This is the only muscle unpaired muscles among the intrinsic muscles of the larynx. If you see here, this muscle is attached to the one arytenoid cartilage, posterior surface of the one arytenoid cartilage, to posterior surface of the another arytenoid cartilage. So what happens is when it contracts, it will pull these two cartilages together, they become nearer, and then what happens is this will be adducted. So adduction of the vocal cords is done by two muscles, lateral cricoarytenoid muscles and transverse arytenoid muscles. Muscles that increase and decrease the tension of the vocal cords. Let's see the diagram first. We are looking the right surface, outer surface of the larynx. This is thyroid lamina. Here is superior horn and inferior horn of the thyroid cartilage. This is cricoid cartilage. This is the arch and this is the lamina. We know that inferior horn of the thyroid cartilage articulates with the side of the cricoid cartilage to form cricothyroid joints. Its axis is passing through from here to opposite cricothyroid joint. So this is the area here or axis here. So the cartilages can move this way and this way in small movement here. So we are going to talk about the muscles that tense the vocal cords. That is cricothyroid muscles, which increase the tensions of the vocal cords. Look here. It is the only intrinsic muscles located outside the larynx. The rest are all inside the larynx. It is a fan-shaped muscle, arises from the lateral aspects of the cricoid cartilage here. That is the arch of the cricoid cartilage. It is attached above to the inferior horn and the lower border of the thyroid cartilage. You can see here. So here it is attached to the lateral part of the arch of the cricoid cartilage, and above it is attached to the lower or inferior horns and inferior border of the thyroid cartilage. When it contracts, thyroid cartilage tilts slightly downwards and forwards. That is around this transverse axis of the cricothyroid joint, thereby lengthening this distance, because here is the arytenoid cartilage, where the vocal cords is attached to the arytenoid cartilage. When this one tilted forward, this distance become longer, and what happens is this vocal cord becomes tense. Muscles that relax the vocal cords. They are Thyroarytenite and Vocalist muscles. Look at the diagram here. We are looking from above. Thyroid cartilage. This is angle of the thyroid cartilage. This is cricoid cartilage. Lamina of the cricoid cartilage. On top of that is a pair of arytenoid cartilages. This is the lateral process or muscular process of arytenoid cartilage. In front is vocal or anterior process of the arytenoid cartilages. Anterior process, there's a vocal process, is attached by, this is the vocal cord here, which is again attached anteriorly to the angle of the thyroid. Now let's talk about the muscles that relax the vocal cords. Thyroarytenite, number 1, and vocalist, number 2 muscles. They relax the vocal cords. Thyroarytenite muscle, number 1, extends backwards and laterally from the posterior aspects of the thyroid angle. That is from here, from the thyroid angle, this thyroarytenite muscle will extend backwards and laterally, and then attach posteriorly to the anterolateral surface of the arytenoid cartilage, and slightly to the lateral surface of the vocal process. So this is thyroarytenite muscles coming from here and attached to the anterolateral surface of the arytenoid cartilages. Next one is vocalist muscle, number 2. It lies within the vocal fold of the larynx. This is, you can see here, on its medial side is the vocal cord is here. So this is vocalist muscles. Again, coming from where? If you see very carefully, coming from the angle of the thyroid cartilage, that is in anterior, and also a little bit it is coming from the vocal cord, vocal ligament. It is inserted into the lateral surface of the vocal process of the arytenoid cartilage. See here, this is the anterior process, there is a vocal process of the arytenoid cartilage. This muscle is attached to the lateral surface of the anterior process here, arytenoid cartilage. So when these two muscles contract, you can see very simple, they are coming from here and attached here. When these two pairs of muscle contract, you can see arytenoid cartilages will be slightly tilted forward. That means the distance between here to here will be shorter. Then vocal cords become lax. Structures attached to the posterior surface of the thyroid cartilage. Let's see the diagram here. We are looking from behind. This is epiglottic. This is the narrow part of the epiglottic called stalk of the epiglottic. Here is the thyroid cartilage, posterior surface. Here is the angle of the thyroid cartilage is here. So this is the posterior surface of the lamina of the thyroid cartilage. What are the structures attached here? Very first one is, you can see here, number 1, thyroepiglottic ligaments, which is attached between the thyroid cartilage and the stalk of the epiglottic here, that is thyroepiglottic ligament. Next, below and on each side is the vestibular ligaments from the vestibular fold on either side. Then below that is again, below the vestibular fold is vocal fold, and there is a vocal ligaments is here. So they are coming from above. Down here is thyroepiglottic ligament. You have vestibular ligament and vocal ligaments are here. After that, the structures just now we talk are lateral to these things are number 4 is vocalist muscles, and number 5 some more lateral is thyroarytenite muscles. Just now we mentioned these two pairs of muscles lacks the vocal cords. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.